Yeah.
Easy to sing if you've got a guitar in front of you. Laughing at sing.
Exactly. Hey everyone, I'm Madonna. This is David, and we're going to talk about complementary medicine today. And because I had a doctor friend of mine in today, and a friend of his is in hospital, and he wanted me to muscle test the best complementary therapies that will help his friend in hospital.
Mm-hmm.
So it was a really interesting little process. It actually went on and on a bit because there's always more to it than what
Right.
you imagine, because once someone, and you went to hospital 6 months with a heart attack, so
Mm.
you've been exactly where this guy has been.
And I'm glad that I was involved in complementary medicine.
Yeah.
But because something that I noticed, like in dialogue and in communication, that the idea of complementary medicine gets confused. Like, for example, so the medical group does a particular thing, the doctors with the hospitals, and I having experienced that in a few ways with cancer and heart problems, my experience of that's been very good.
Yeah.
But because I use complementary medicine, I know how to talk to the nurses or the doctors to get my point across so that
Yeah.
I can work out which supplements I can take with the medications. And
And making them do research as well, because the
and I
answer
did,
is
and
nearly always no. You
right,
can't unless they do
except
some research.
right, and if they do, so you have to ask, right? Are there any contraindicators? And that needs to be looked up, and it's not that complicated, but
Yeah, they've got to do 3 minutes of work.
yeah. But the thing is that the difficulty is with complementary practice is that when one side of the bridge isn't doing the job as well as they could. Now that's not only in say because some people have issues with medicine, and then some people who are complementary practitioners don't have any issue at all.
Yeah.
And but also there's complementary practitioners that it's easy to have a problem with too, because everybody's not perfect, and some people aren't as good as other people,
Yeah.
right? And so my way of looking at it as a holistic counselor, I have to stay in the middle, right, and not really because basically what people do is their choice, so it's sort of a consent issue, and so it's like my view as a counselor. I kind of keep a middle position, and I'll take the advice of both their whoever their practitioners are, whether it's a doctor or a naturopath. I'll take all advice because that's the best way to get an outcome. Because, say for example, reducing stress during the procedure is important,
Yeah.
and so if there's too much of a intense idea on either side, that might interfere with the. Because just say we've got a lot of stress because of concerns, then that can cause complications.
Right.
I'll give an example. When I was in hospital with a heart attack, I had some prayer beads and they got taken. And and a couple of other things got taken too. And the stress of that caused my blood pressure went up to like 170 over like maybe 90, and it stayed up like that for hours because of the stress. And I just had heart surgery. And so that means that stressful situations in emergency can really push us over the edge.
Yeah.
And so if one side pushes too hard against the other side, it's going to put the person in a stress position.
Yeah.
Whereas we need to point out the obvious problems, like because counselling is the same as any therapy.
Yeah.
Because we're looking at both causes, because there's a support role, there's a causation role, and then there's a therapy role. And everything has that. So as a counsellor, you sit in between because a lot of people that you're counselling have other illnesses as well. They'll be on different meds, they'll be on different natural supplements, and you have to work with that equation in a harmonious way until at least they're stable enough to start really pushing something.
Yeah.
What do you think of that, Madonna?
Well,
That's my little expression from someone who sits outside both of those industries
yeah.
in an observing position as a different type of
So from
therapist.
within traditional medicine, and having been for 30 years, I find that doctors don't play. Doctors don't play. 99% of the time they say don't take anything else. Or they say you'll just get expensive urine. Or they'll say, well, if it's not hurting, you know, it can't, if it's not hurting, then I suppose it can't hurt you. So they have all these demeaning combinations of things that they say to people so that people feel like idiots by taking natural therapies, and they do. I had a lady in yesterday, and I said to her a couple of times, you should tell your doctor, because she's managed to stay off blood pressure medication for the last 8 years with me.
Mm-hmm.
But whenever the doctor asks her what meds she's on, she says, I'm not taking. And she said, well, how are you keeping your blood pressure under control?
Yeah, but if you measure your blood pressure and it stays around anywhere 100 and...
It used to be very high. She got it down naturally.
Yeah,
and she won't tell her doctor what she's done because people are scared of being ridiculed and made feel ashamed and stupid trying things that are natural.
I've been to the doctor and they've said words like home remedies.
Yes.
When you mention supplements.
Yes.
And
which is demeaning.
Well, it's an insult. But both sides can be demeaning. And because, for example, because the medical industry doesn't look at the causal side or the total metabolic health side as much. So they have
no interest. Or very little.
But the problem is that type of no absolute statement from either side is kind of a bit, demeaning, can be seen like that when it's in a discussion of like health professionals.
Yeah.
Because the normal layperson doesn't understand, so they just see the top layer of the thing. Whereas because, like, for example, a good example of it is the fact that health or diet can have such a big effect.
Massively, yes.
Like a massive effect, whereas you go to hospital and it's a really nice menu. Like the last one I went to was in the private hospital and the menu was great and fun, but there wasn't...
There wouldn't have been a lot of good proteins.
No, there was only tap water for a start. And then, and the thing is that, like if you want to have a what I'd call a normal diet, you couldn't actually have it, really.
Yeah.
And I wasn't being critical, so I enjoyed it because I was on holiday. But at the same time, it wasn't the diet that... Because if you look up heart health and you look at the main foods, like chickpeas is the main food for heart health, and there's nothing...
As a vegetarian,
there's nothing in the thing with that. Now chickpeas is one of my main things, and I really like them anyway because I'm a good cook and I can make lots of things, tahini, but the thing is that the critiques from both sides are kind of a little bit true sometimes. And so it's important to look and go, there's actually two layers of stuff going on here. Like everybody knows that if you've got high blood sugar and you start eating a lot less, which is changing your diet, the blood sugar problem can just go away.
Oh.
But if
you're changing it to the right stuff.
Yeah, but that's what I mean.
No, but that's not what you said.
Well,
so if you reduce the amount you're eating and you're still eating lots of wheat and sugar, then it's not going to improve.
No, but I know, but I know how people eat. People sit there and eat a whole block of chocolate, right? And they'll eat 5 sandwiches in a row. Like, I know what overeating's like. And the thing is, if you reduce that back to a normal thing, a lot of things will correct themselves, right? That's got to be... Because the reason the blood sugar was high, a lot of it was because constant overworking with not very nutritional foods, and that becomes a metabolic problem over time. But
the super refined diet is really bad for us.
Right, but all I'm saying is just by improving our diet, our system will make so many improvements automatically.
Yeah.
If we just change to healthier things with better proteins, and even if we go to organic, if we change the quality of our diet,
absolutely,
so many problems will heal by themselves.
Yes.
And that's a lot of the information that naturopaths give to people. Like, because it's well known that, for example, in medicine, diet's considered not important.
Mm-hmm.
But when you've got, say,
in fact, it's quite a deliberate work against doctors to understand that. So most doctors, when they start, they're really wanting to be healers.
Right.
When they start their training, and they are trained against nutrition.
Yeah, I know. And that's how the rhetoric is. But for me, I'm like, so I know that. And then once we know that, we don't really have to address that anymore, because it's just like this thing. And it's like, once you work out, if I eat properly, it can correct so many things.
People are still told that diet doesn't matter. These days, especially with things like diabetes, people have those little doodads put on them.
Yeah.
And then they eat sugar when it goes off.
Right, and
So
that's
they're
where,
destroying their
right,
pancreas faster.
because kind of what's happening there is with the, so think about the length of treatments. When you've got 5 or 10 minutes, you can really only make an adjustment to what's there, right? Because the amount of time it'll take to do a diet plan or something like that, it's really going to have to go through what's there. And
Yeah.
right, so one way of looking at medicine until you get in hospital with specialists, it's basically just putting something there, leaving everything as it is. This is how I've always looked at it. You're leaving everything as it is and adding to it.
Right.
Right? And that would be sort of right.
Yes.
And so don't change your diet, don't change, maybe say improve exercise. It might be very short, but it's not enough time, and then just take this and see if it improves. And a lot of people are so busy, that's all they want to do. They're just like, give me the script, okay, now we go. And that took 10 minutes total in their life, and they didn't want to spend 4 hours.
Yeah.
Or 2 hours even.
Yeah, no, I think that going back, the golden time for naturopaths was about 10 years ago, and previously before that, about 25 years ago.
Right.
But there's been huge times in my career where medicine has no interest whatsoever.
No, so I find, like, because I know a bit about this, and I used to run a design business, and I used to market to all different types of therapists. There is a wall of no hearing on one side, and it's not as bad on the other side because, for example, if you've got a wall, don't worry about diet, don't worry about supplement, even vitamins, for heaven's sake. It's like, well, that's a bit of a brick wall, but on the other side, that doesn't really go there, because if you're a naturopath, you still want to know what the blood tests say. You still want to know what you still need to know all that stuff to work in a complementary way, which is why it is complementary, because the naturopath will use both. They'll get all the, like, the questionnaire will have all the available information about meds you're on, processes you're in, except that's not two ways all the time, which means that it can make naturopaths look a little bit more negative than they are. Whereas actually what they're doing is an entirely different thing, working with what the medical association's doing, and then adding, subtracting, and work with it to actually get things working better.
And sometimes at the very least, at the very least, sometimes people come in, just say chronic fatigue and fibromyalgia, which is so rife these days. So aches and pains from head to toe and just no energy. Really, really common. And, some of the biggest causes of them are toxins building up in the body. And if you ask a doctor about that, they might do a blood test, say, well, we can't find any lead. But it doesn't mean it's in your lead. It doesn't mean it's in your bloodstream. It might be in your brain or in your heart or in your liver or in your kidneys.
Some people might have toxins from their workplace. Like, for example, I used to work in an importers. We had methyl bromide all the time. I'd get sick. But then if you order the blood test, A, you can't get it, and B, it'll cost $500.
Yes. Right, and you have to have it in your bloodstream at the time. Now, your bloodstream will constantly try to pull the toxins out and dump them deeper inside the body if your blood, your liver, your kidneys, your breath can't get rid of them. So if it can't get rid of them, it will make it go deeper inside.
Right.
Absolutely. And heavy metals is one of the main reasons for skin cancers and things like that. So that external, we're taking that stuff in from the environment all the time, as well as excreting it from inside.
Right. So even though it looks like naturopaths are like they're pointing out all of these negative things, but that's just like the fact that the way it is. And it's really helpful, and it's an entirely different process.
Totally.
Because it's dealing with the underlying factors. Like, for example, just say you've got a weight problem and you can take a drug to get rid of it, or you can get a good diet made up from your naturopath who's a nutritionist.
Yes.
That'll treat the cause of what the symptoms are.
Yes.
But not the other way around.
Yes, but also the naturopath will also look at your thyroid and your kidneys and your liver and all the other reasons.
But that's what I'm saying.
Why we have poor metabolism.
And that is the point. So they're two different things, and one's working on the deeper causes, right? Which is like, for example, if you've got diabetes, if you can solve the weight and the sugar problem, it might just go back to normal.
Yeah.
Right?
Yeah.
Or you can take something, you can take herbs or things to help the sugar get down, which are both good. But ultimately, if you can change your whole lifestyle and everything, you could end up with a better outcome for another 20 or 30 years.
True. Beautiful.
Is that a nice way? So I just thought we'd put that, because things out there in the world get pretty intense, and people are taking very strong absolute positions when a more relative position is more helpful.
Yes. Yes. Well, even our doctor friend, his friend who's in hospital, part of the reason why he hasn't been to hospital for the last few weeks is because of the negative impact that the last 5 years has had on the psyche of a lot of Australians because of what was happening to unjabbed people during COVID.
Right.
So because they were isolated and put aside and given treatments that were dangerous,
Well, they didn't give
there's
me
a
one.
lot of.
And that was interesting.
You were only there 6 months ago. That wasn't during COVID.
Oh, well,
So going back a
still
year ago, they were still giving remdesivir and respirators. So they're still doing these treatments that kill 90% of people.
But we're
Anyway,
saying complementary.
yes. Anyway, but it's always good to have people in your team who are from another perspective, because people often say, I need a second opinion, but they go see another neurologist or another doctor.
But it should
You're
be.
going to be getting people who are trained the same way. Get someone who's trained in a different way so you can get another perspective.
Yeah, or like just take your naturopath's advice and argue it.
Well, they might not have a naturopath.
Oh, well, okay.
Yeah.
All right.
Anyway, cool. Okay. School holidays, got to get back to the kids.
Have fun. We're going to footy practice.
Okay. See you later, everyone.
Bye.
Bye.